Hi, I am Dr.Uttam Kumar Das DVM CU MS BAU. I am inviting you a new online session on veterinary medicine. Today I would like to discuss about jaundice. This is also termed as icterus. I hope all of the vets and veterinary students are fine during COVID-19 period, and I hope you are staying home and you are safe and you are keeping social distance also. So let's start about jaundice or icterus. Jaundice or icterus is nothing but yellow discoloration of sclera skin, also characterized by increased bilirubin and orange color urine. First, we have to know some basic idea about reticulum endothelial system. I think you will gather the knowledge about reticular endothelial system with the help of various books and literature. You have to know the normal level of bilirubin also. You know the lifespan of RBC 100-200 days, 120 days only. After that, this RBC is phagocytized by macrophage, and then heme and globin is divided by this macrophagic phagocytes, heme and globin. Try to understand the matter, and then heme is then oxidized by heme oxygenase enzyme, and biliverdin is produced. Heme to biliverdin by the enzyme heme oxygenase, and this biliverdin is then converted to bilirubin by biliverdin reductase. Heme, biliverdin and bilirubin, two enzymes involved, heme oxygenase and biliverdin reductase. This bilirubin that is produced before entering the liver, this is unconjugated bilirubin. This unconjugated bilirubin is then conjugated within the liver. How it is conjugated in the liver? It is this bilirubin that is unconjugated is then glucuronic acid added to glucuronic acid by UDP glucuronide transferase enzyme, and then produces biliverdin diglucuronide. Bilirubin diglucuronide. Bilirubin plus glucuronic acid equal to bilirubin diglucuronide, that is conjugated bilirubin. Enzyme involved in this process, UDP glucuronide transferase. UDP glucuronide transferase. Try to understand the matter. This conjugated bilirubin is also called bilirubin diglucuronide. This conjugated bilirubin is also water soluble and then excreted via bile to gastrointestinal tract, and within the gastrointestinal tract it is converted to urobilinogen and stercobilinogen. Stercobilinogen is then oxidized to stercobilin and then passes through stool or feces, and then part of urobilinogen also reabsorbed and then excreted through urine. This is the normal pathway of bilirubin. What happens if jaundice is produced? Jaundice is a symptom, not a disease. Pre-hepatic. This pre-hepatic jaundice, hepatocellular jaundice and post-hepatic jaundice. Three types of jaundice mainly. This jaundice may be also categorized as fungal, viral, bacterial, protozoal, etc. According to infectious as well. But the main category, principal category is pre-hepatic jaundice, hepatocellular jaundice, and post-hepatic jaundice. Pre-hepatic jaundice is caused by excess breakdown of RBC. Normal breakdown of RBC produces normal level of bilirubin in the body, but excess breakdown produces high level of bilirubin in the body. That is, pre-hepatic jaundice is characterized by increased amount of unconjugated bilirubin. In case of hepatocellular and post-hepatic jaundice, both conjugated and unconjugated bilirubin you can find. Post-hepatic jaundice also termed as obstructive jaundice. Hepatocellular jaundice, this is caused by dysfunction of hepatic cell. I would like to mention some causes of jaundice. Pre-hepatic jaundice. Pre-hepatic jaundice is mainly caused by hemolytic anemia. Hepatocellular by alcoholic liver. This is applicable in case of human being. And viral hepatitis, iatrogenic by medication. Hereditary, autoimmune disease, primary biliary cirrhosis, and hepatocellular carcinoma. These are involved in hepatocellular jaundice. Post-hepatic jaundice, gallstone, cholangiocarcinoma, stricture, cholestasis. These are mural cause, and extramural cause are pancreatic cancer, abdominal masses, lymphoma. I'd like to reply all these causes again. Pre-hepatic by hemolytic anemia, hepatocellular jaundice by alcoholic liver, viral hepatitis, iatrogenic by medication, hereditary, hemochromatosis, autoimmune disease, primary biliary cirrhosis, hepatocellular carcinoma, post-hepatic jaundice, that is obstructive jaundice by gallstone, cholangiocarcinoma, stricture, cholestasis. These are called mural causes, and extramural causes are pancreatic cancer and abdominal masses or lymphoma also. In case of diagnosis of jaundice, you have to pay attention about anemia. You will also find increased MCV, thrombocytopenia also. Bilirubin is quantified to see the degree of jaundice. Albumin also marker of liver synthesizing function. So bilirubin, albumin, anemia, increased MCV, thrombocytopenia, all these things should be considered. And you will also find some aminotransferase enzyme, increased aminotransferase, AST, ALT, spotted aminotransferase, also alkaline phosphatase, increased alkaline phosphatase, increased GGT, increased gamma glutamyl transferase, so on. So you have to single diagnostic procedure, you cannot identify the cause. You can do some biochemical test also. You can also go for X-ray, X-ray, ultrasonography, you have to differentiate some of the pigment, like carotenemia, also cause discoloration of mucous membrane. Rifampin also cause discoloration of mucous membrane. And you have to mind about autoimmune liver disease. Some common symptoms: yellow eyes, yellow mucous membrane, loss of appetite, weight loss, lethargy, swollen and painful abdomen. Not all cases, sometimes you may find increased urine output with orange color urine. As liver may involved with jaundice, there is reduction of clotting factor, so bleeding may occur, internal bleeding. and fluid-filled abdomen you may find. Neurological sign you can also find, because main function of the liver is detoxification. So if detoxification ceases, um, neurological sign may arise. As and there is distraction of RBC, you will find anemia, loss of appetite, weakness. You will also see vomiting, rapid and shallow breathing, excessive exercise intolerance, pica, that is eating sand. This is for neurological some breed specific jaundice for dog, copper associated chronic hepatitis, found in Bedlington Terrier, Chihuahua, Cocker Spaniel, Dalmatian, Doberman, West Highland White Terrier. Immune mediated hemolytic anemia. This type of jaundice is found in Cocker Spaniel, Finnish Speech, Irish Setter, Poodle, Old English Sheepdog. Alaskan Malamute, stomatocytosis, in case of Alaskan Malamute, pyruvate kinase deficiency in case of beagle. These are hereditary cause for jaundice among these dog breeds. Scottish Terrier, vacuolar hepatopathy, Springer Spaniel, phosphofructokinase deficiency. So we see that liver cancer or cirrhosis can cause jaundice. Infectious agents like leptospirosis, early cirrhosis, and babesiosis can cause hemolytic jaundice. Pancreatitis also can cause jaundice. Poisonings like phenobarbital that is given for epilepsy also cause jaundice, and acetaminophen also causes jaundice. Inherited, already discussed breed-wise. Idiopathic jaundice cause is not exactly known, and if severe trauma of liver, it may cause jaundice. And immune mediated disease already discussed breed-wise. Hypophosphatemia also causes jaundice. Heartworm may cause jaundice. Excess zinc, lead, other toxins can cause jaundice, and incompatible blood transfusion may cause jaundice. So, treatment of jaundice is dependent on underlying cause. That is, if it is identified as infectious, such as babesiosis, so apply imidocarbon diclofenac. If thalassosis, so as you should use a specific drug. If it is obstructive jaundice, then you have to identify the case. The single diagnosis or single test. Single test is not perfect for this for the diagnosis of jaundice. You have to do multiple diagnosis for jaundice. We have to arise a decision whether it is hemolytic anemia or hepatocellular or obstructive jaundice. So some treatment you have to consider, just as supportive vitamin K you can use as that as clotting factor and blood may be reduced due to liver dysfunction, so you can use vitamin K. You can use antioxidant also. This will reduce free toxic radicals. Antioxidant vitamin K you can also use for 5% glucose if dog is weak and blood transfusion if possible, and you have to consider case to case in case of jaundice. Again, I am telling you, jaundice is not a disease, it is a symptom. So you have to find out the cause of jaundice. So I think you already have some idea about jaundice, mechanism of production of bilirubin, types of jaundice, causes of jaundice. If you know the mechanism of production of bilirubin, and you'll understand easily in the production of pathogenesis of jaundice. So thanks to everybody. Next time I am going to give you a brief discussion about genetic disease. Up to that time, be hale and hearty. Thank you, everybody.